WNN Talk 1470. WWNN Pompano Beach, Boca Raton, Miami, Fort Lauderdale.
You asked for it, and now you got it. Backed by popular demand after 21 years on this radio station, Peter Bruno is back with a new radio program designed to help you make money. Tune in to Buy, Sell, or Hold, heard daily at 4:30 p.m.
You get your monthly mutual fund or 401k statements, look at the bottom line and say, is that it? If after all these years your investments are still making diddly squat, do it yourself. Learn to trade stocks, options, futures, and Forex at Online Trading Academy in South Florida. Learn in real classrooms where students of all ages are taught how money is made in up, sideways, and down markets using a patented rules-based strategy taught only at Online Trading Academy. All instructors are certified, currently trade, and profitable. They show you what they do every day. Most students trade with a couple of $1,000s. Since 1997, Online Trading Academy has taught over 100,000 students. You can do this. Tired of low returns? Call now and reserve 2 seats to a free class to see how the banks and institutions trade. Seating is limited. Call 954-668-2510. 954-668-2510. That's 954-668-2510.
Talk 1470 WNN is now available on iHeartRadio. Download it now for free on your App Store and take WNN with you wherever you go with iHeartRadio.
Talk health. Talk wealth. Talk politics. Talk 1470. WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everybody. Welcome to Caregiver Solutions Info. Thank you for joining us today. I'm so glad that you did. This show is for caregivers, for family caregivers taking care of someone with Alzheimer's or dementia, or for professionals that really want to learn more about the disease and how to help people. So thank you for joining us today. Today is Tuesday, October 27th, 2015, and today we're going to be talking about the differences of nursing homes and assisted living for dementia and help you determine which is better for someone with dementia depending upon what's going on in their situation in their life. So we're going to be doing that. But first, we always have brain boosters. Now, brain boosters is something for you to help you retain the memory that you have or to help improve your memory, because after all, that's what we all should be doing, because it's important to keep brain health as well as our physical health. So last week we had Brooke Wozek on. She is a yoga instructor, and she shared with us all about how yoga can help us de-stress and all the benefits of doing yoga. And that was so wonderful. But today we're going to talk about a different kind of yoga, a little bit more unconventional, and it's called laughter yoga. Don't know if you've ever heard of that or not, but it's something that is spreading all across the world. It was started by a doctor in India, and it has been proven that laughter really is a good medicine. Might not be the best one, but it really is good, and for lots and lots of reasons. So they have actual laughter yoga clubs, and they're teaching people how to be happy. It's important for caregivers, of course, to be happy, but a lot of times you have nothing to be happy about, and so sometimes we have to force that happiness. And studies have shown that there really is no distinction between real, genuine laughter and fake laughter. And so what laughter yoga is creating fake laughter in the beginning, and then it magically transforms into real laughter, because laughter is contagious. And when someone starts laughing and people start laughing with them and along with them, it becomes contagious, and then everybody seems to be in a better mood and everyone's happier. So laughter yoga is good for you. It's a big stress release, but it's also good for the person that has dementia, because laughter yoga is something you can do together. It's a form of therapy in a way, and it's something that you as the caregiver can do with your loved one. And they do have these laughter classes, laughter yoga, different places, maybe where you live, you can check it out. And you go in with your loved one, and they take you through, they start clapping, you're moving, you're doing the ha 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 and the he he he's, and pretty soon everybody's rolling on the floor laughing. And the benefit of that is twofold. First of all, it's very good emotionally, because when people are laughing and creating a bond, you have more of an emotional bond with your person that has dementia, because you're in it together. It's creating that bond, the relationship. And we all know that people with Alzheimer's, they live in the moment. And so for that moment that they're laughing, you know that they're happy. And that's a really good thing. And so laughter yoga is a really good thing. It actually has been helpful to reduce blood pressure, definitely reduces stress, has more oxygen, creates more oxygen into your body, goes to your brain, and we know that's a good thing. It's wonderful for your mood. It helps you have more energy. It feels like you can just, keep on going when the road is tough, and it lasts with you, and it puts you in a more positive state so that you can deal with those stressful situations, and you can kind of handle the negative better. Not only negative situations, but negative people. And so laughter yoga is awesome. Try it. I've actually done it before, and it was really, really fun. And if you want to learn more about laughter yoga, you can go to have a website. It's called laughteryoga.org. Check it out. You can read all about the different benefits of laughter yoga. You can find a laughter yoga class in your area and have some fun, and hopefully that'll make your caregiving a little bit more stress-free and fun. So that's the tip of the week for Brain Boosters. And when we come back, we're going to be talking about assisted living and nursing homes, and what's the difference, and how do I know which one my loved one needs. But we're going to teach you that, because after all, this is an educational program. So stay tuned. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help, because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice. Take a pen and jot down this information. Right from the Heart assists families in finding the right living arrangements for their aging parents. Founded in 2012 by Sharon Agate, Senior Lifestyle Consultant, Sharon has counseled seniors and their families for over 20 years in clinical settings and in independent assisted living and memory care communities. Finding the right community can be overwhelming and time-consuming. Right from the Heart takes the stress and worry from you. Sharon will meet with mom or dad and evaluate their needs and lifestyle preferences and create a personalized plan at no cost to you. She will accompany you to visit selected communities and guide you every step of the way so you can be assured you're making a well-informed decision. Call Sharon at 561-374-4696. Sharon's promise to you is in your knowing that her advice will always come right from the heart. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, I want to first of all thank our national sponsor, Arden Court's Memory Care Communities, for making the show possible to the caregivers out there. Arden Courts is one of the best at providing dementia and Alzheimer's care all across the United States. They have over 50 Arden Courts communities, and they are there for you, the caregiver. You want to check them out because they can give you lots and lots of support and lots of information. And one of the things that Arden Courts likes to do besides help people that have dementia, they also like to help the caregiver. And so one of the programs that Arden Courts offers is a free day of respite. What's respite? Respite is a time for you, the caregiver, to have some time off from your caregiving duties and feel that your loved one is in a safe, secure environment, knowing that they're going to get what they need at the same time you getting what you need, which is time away, because your loved one probably needs time away from you as much as you need time away from them. And so Arden Courts would like to offer a free day of respite, and all you have to do to find out about that and schedule it is call the Arden Courts toll-free number, which is 888-478-2410, and tell them that you heard about the offer on the Caregiver Solutions Info radio program or saw us on your internet, and they'll be happy to help you with that, schedule that, let you know. You can also go to their website, which is arden-courts.com, and find out lots more about Arden Courts and all the services that they have to offer for you. So take advantage of that. So today we're going to be talking about the differences between assisted living and nursing home. A lot of people use those terms interchangeably, but they are not the same. They are two distinct types of facilities. They do different things. They offer different services, but they do have some similarities. And so it can be very confusing for caregivers out there because doctors will even say, oh, your husband needs a nursing home. And that is hard to hear. It's very scary. It's like, oh my gosh, I didn't know he was that bad. And maybe in reality, your husband does not need a nursing home, and what he really needs is an assisted living for his dementia to take care of. So we're going to talk about that today because it is very confusing. There's lots to know. And so today in here, we have Katie DeRocher. Hi, Katie.
Hi, Marcia. Thank you for having me on.
You're very welcome. I'm glad that you're here. Katie is the Admissions and Marketing Director of Manicare Health Services right here in Boca Raton.
Yes, it's on Yamato Road, just east of I-95. And
Great.
It's 180 bed facility.
180 beds. Okay. So, it is confusing. I know that you probably have a lot of people that ask you the same kind of questions. Does my loved one need a nursing home? How do I know? So we're going to talk about that today because people really should understand the progression, not only of the disease, but the progression of the kind of care that somebody would need, whether it would be at home, in an assisted living for dementia care, or in a nursing home. So you have experience in the nursing home. I have experience in assisted living. So we're going to talk about and have a conversation about the differences and how we can help people know when's a good time to consider dementia assisted living, when's a good time to consider nursing home, because that really is one of the hardest things, don't you think?
Yes, it is.
Yes. So tell me a little bit about a nursing home. What are, in general, how would you describe services or describe a nursing home environment?
Well, at our nursing home, we offer therapy services. Usually it would be covered under Medicare, if you have Medicare, or insurances, Cigna, Aetna, United. Usually you would have a hospital stay if something happened, if you fell, broke a hip, or you've had a knee surgery, you've had a 3-night stay in the hospital, you can qualify for skilled nursing services. And
and we're going to get a lot more into that too, because that's another whole topic when we're talking about rehab and things like that. So basically then what you're saying is a nursing home is not just a nursing home, but it could also be a short-term rehab.
Yes, so for both.
Right. So sometimes there's different services depending upon what your needs are. Sometimes it might be long-term, right? Forever until you go to heaven, I say.
Yeah, they can turn into that, yes.
Right. Or sometimes it's short term if you're there for some therapy, some other kinds of treatment. And so typically here, at least in South Florida, where we are, how yours is 180 beds, right? And is that typical size for a nursing home?
Yeah, it's a very large nursing home. We also have a 32-bed dementia unit that's part of the 180 beds. And that is dementia specific. It's a locked facility, and we have patients coming in. A lot of them are getting therapy too in that unit, or they're staying for long-term care under, Medicaid. But we do offer that as well.
Okay. So does every nursing home, now I have to stress because nursing home is a generic term. Sometimes people call it a SNF. And why do they call it a SNF? What does that stand for?
Skilled nursing facility.
Skilled nursing facility. So sometimes people, will do the short version and call it a SNF. It's not that you have the sniffles and that you have a cold, but that's what it stands for. And for an assisted living facility, sometimes they call it an ALF. So, if you hear those terminologies, it's just short. It's just a shortcut to talking about different kinds of places. But in a skilled nursing facility, do they always have a dementia unit within the skill? Not always.
No.
Okay.
Not always.
Not always. So that's another thing when you're dealing with dementia and you're looking at nursing homes, you want to make sure that the person is going to be appropriate. And one of the things you probably want to find out is, do they take people with dementia? Can they handle people with dementia? So that's another good thing to know.
Yeah.
So what kind of professionals would work in a skilled nursing facility? Obviously, you have nurses.
Yeah, we have a lot of nurses. We have RNs, we have LPNs, we have CNAs, around the clock, 24-hour nursing care. We have physicians that come into the facility to see patients, specialists. We have internists. We have cardiologists, podiatrists, dentists, dermatologists. A lot of physicians that are available. And, also we have nephrologists. A lot of them are getting dialysis. They can also go out to the physicians if they're not able to come to our facility.
So a lot of doctors actually come into the skilled nursing facility to render specialized services. But then in-house, you also have your employees who also perform certain tasks like physical therapy, right?
So you would physical therapy, occupational and speech therapy.
Right. So that they're there all the time.
Yeah.
And then as needed, different doctors would come in, do follow-up, give consultations.
Yes.
Okay.
Exactly.
Okay.
Practitioners. Yeah, we have a lot of healthcare professionals there available, which is nice. Not every facility can say that. So.
It's a busy
huge
place.
selling point, yeah.
It's a lot of comings and goings there
Yeah.
at your place, and it's important for people to know what is. I think back in the day, before there was really dementia-specific assisted living. Now, Arden Courts has been around for 20 years, as you know, and we're your sister facility, your sister in the whole big picture under healthcare. And before Arden Courts came on board, I think a lot of people who had Alzheimer's and dementia, they had to go to a nursing home, or maybe they just stayed home, but a lot went to nursing homes. And so now that there's specialized care for people that have dementia, we want to make that distinction between an assisted living for dementia and a nursing home, because there is quite a large amount of differences depending upon what the needs are of the person at that time. So basically, if someone has dementia, and you want to check out the availability of what's out there, and you start at home taking care of somebody and it's getting tough, you might have some home health. And I know a lot of people that have come to Arden Courts, have come to Manor Care, they have home health at home. But it gets hard. You
That's
have
very
stressed
hard.
out caregivers. They tell you that all the time.
Very.
It is very hard. And so sometimes they need more help. And the next step would be from home. The next step would actually be to an Arden Courts, a dementia-specific assisted living. And why is that? Depending upon how long the person is at home, depending upon their physical abilities and sometimes their behaviors, the next step would be to look at dementia-assisted living. Now, why would you want to do that? Well, one of the bigger differences between an assisted living and a skilled nursing is more of the environment. I think that, people are used to going to nursing homes. Maybe they've visited someone there and, gone to see their grandmother or someone recuperating. And they're very nice, but they're more clinical looking in a way with the nursing stations and the different wings.
It's more like a hospital type setting, post-acute.
Exactly.
Yes.
More like a hospital. That's what I describe it as.
Yes.
Not a hospital, but
Step down
from a hospital, because obviously people can go from a hospital to a rehab to finish getting better before they go home. So it is a step down. But an assisted living for dementia is more of a home-like situation where they have the comforts of home. I always say it's like home but better, because they can be in their own home, feel like home, looks like home as much as possible, with everything that
included.
they need.
Yeah, everything's there for them.
Including help 24/7. So in an assisted living like Arden Courts, we help the residents. We call ours residents. I think you call yours patients. So we have a little bit of terminology differences there. But we help our residents with everything they need help with, and let them be as independent as possible. So if they need help with dressing, bathing, toileting, eating, walking, those kinds of things, we're there to help them. Our caregivers, we call our people that help our residents caregivers. So our caregivers are there to help them. And when someone isn't appropriate anymore for a dementia-assisted living, then we might want to look at the option of having them go to a skilled nursing facility. So that's kind of the difference, because it's a pattern, it's a step. People that are home, if you don't have any dementia, they go to maybe an independent living first. Because why?
Because they can do things on their own.
Right, and they don't want to.
They don't need the help yet.
Don't need the help. Don't want to cut the grass anymore. Don't want to clean, cook, have everything that they need. And they're great. They can come and go. Then as people get a little bit more needy for medication management or a little bit more frail, but let's say there's still no dementia going on, but they're just getting older and they need a little bit more help, they might go to a regular assisted living where they can get that kind of help. Then if dementia comes along, that's a whole other ball game. So they need another step up. So as we're stepping up in levels of care, we're also stepping up in cost, right?
Yeah, it's very pricey.
Right. So you have to understand that, as you're stepping up in care, it's like stair steps. Your cost is going up with that because the more care that's rendered, obviously, the more hours and help and specialized people are involved. They're going to be taking
Higher
care
the
of you.
expense, yep.
Right. So that's something, too, that a lot of people that I've talked with over the years, over 15 years, they don't understand that difference either. Some people think that a nursing home is the place to go until they realize that it's more expensive than an assisted living and that they don't need it yet. Now, if you need it, you need it. But if you have a choice, then and you're watching, your budget and you're looking at the quality of life of what's rendered at each place, you really want to make sure that you're fitting the facility with the person. Mm-hmm. So tell me, Katie, some of the reasons why people would come to your Manor Care, to either live there full-time or to be there short-term. Give me some scenarios for, let's say, a rehab situation. What would be a scenario why someone would come to you for that?
Well, definitely a higher acuity patient. We're going to have patients that come in, they have a PEG tube, they've had, dialysis, or they're still getting dialysis. They need to get it in our facility. They're getting TPN,
What's
which is
TPN?
It's a type of nutrition that they get. It's a medication. It's different kinds of patients are on it. Usually the hospital will take them off of it before they come to us, but they have different kinds of things, expensive medications sometimes.
That comes through an IV?
Mm-hmm, yeah,
okay,
you do
so
quick
IVs?
lines or IVs, yeah.
Mm-hmm.
There's a lot of different things. Bedbound patients, where they can't get out of bed at all. If they're not able to walk, we will take care of them at the facility with Hoyer lifts to get them in and out of the bed every day and to take care of them. And, the wheelchairs, the walkers, we provide all that stuff if they can't get around. And then the dementia unit that we have, that's 32 beds, is for patients that are ambulatory and they're exit seeking or they're wandering.
So it's locked.
Mm-hmm, it's locked. They can't get off the unit.
Mm-hmm, because you can't let them walk right out, so it has to be secure for them. Okay.
Secured.
All right. But they can get a lot of the similar services if they need it right there.
Mm-hmm. They can get therapy still, yeah. And they have the nursing care. They have their own dining area on that unit and their own courtyard. Mm-hmm. So you keep everything separate, but they still have access to the same benefits that all the other patients would have.
Okay, good to know, good to know. And so if someone were to be at home and let's say they broke their hip, they would go to the hospital, and then from the hospital they would probably come to rehab at Manor Care or other skilled nursing facility to get physical therapy.
Yes,
and
occupational, yeah. And the goal is to go home or even sometimes go back to their assisted living, which could be Arden Courts.
Okay.
When they can start to take care of themselves again with minimal assistance, they would go back to the assisted living.
So the goal for short-term rehab then is to get better as best as you can, hopefully the way you were before you broke your hip or whatever it was that you broke, and then get back to your normal activities, back to where you were living, whether it be in your own private home or in an assisted living.
Yeah, that's the goal.
Okay, good. So we're going to take a short break, and when we come back, we're going to talk to Katie about lots more that you need to know about nursing homes and assisted living. Stay tuned.
Take a pen and jot down this information. Right from the Heart assists families in finding the right living arrangements for their aging parents. Founded in 2012 by Sharon Agate, Senior Lifestyle Consultant, Sharon has counseled seniors and their families for over 20 years in clinical settings and in independent assisted living and memory care communities. Finding the right community can be overwhelming and time-consuming. Right from the Heart takes the stress and worry from you. Sharon will meet with mom or dad and evaluate their needs and lifestyle preferences and create a personalized plan at no cost to you. She will accompany you to visit selected communities and guide you every step of the way so you can be assured you're making a well-informed decision. Call Sharon at 561-374-4696. Sharon's promise to you is in your knowing that her advice will always come right from the heart. Do you need the advice of an elder law attorney but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. They bring elder law, to you by meeting with you in the comfort of your own surroundings to discuss your personal situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143. 954-383-1143. They bring elder law to you. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We're back with Caregiver Solutions Info. We're talking to Representative Katie DeRocher from Manor Care Health Services right here in Boca Raton. And joining us with her is Carrie Ann Baker. Hi, Carrie Ann.
Hello, how are you? Thanks for having us.
You're very welcome. Tell me what your position is at Manor Care.
I'm the Administrative Director of Nursing Services.
Okay, so you are a nurse.
Yes, I am.
All right, and being the nurse, what are you responsible for?
Well, from an admissions point of view, I'm responsible for ensuring that the patients coming into us are appropriate, meaning that we have the necessary skills, tools, and equipment to take care of our patients.
Okay, great. So that being said, what would be appropriate? Give me a typical patient that would be coming to you that would be appropriate, and then give me an example of someone who would not be appropriate.
Okay, a patient coming to us that would be appropriate would be someone post-op orthopedic patient, or a patient who has multiple comorbidities but are in a stable state, meaning they don't need to be on continuous IV drips for anything other than for antibiotics. Anything other than that, or TPN. We do TPNs as well.
Maybe you can explain a little bit more about TPN, because Katie mentioned that,
Yes.
and I'm not familiar with TPN because I come from the assisted living world.
Okay.
And tell us what that is.
TPN is total parenteral nutrition. That is when our patients are not able to take in and digest food the normal way. And so the doctors will resort to giving nutrition through the veins. So it's called total parenteral nutrition.
Is that different than a feeding tube or a peg tube, as they might call it?
Completely different.
What's the difference?
The difference is the TPN is with electrolytes, etc. It's compatible to the patient's blood system, right? While the tube feeding, it's nutrition, but just in a liquid form. So it goes through the digestive tract and then gets absorbed into the patient's body, while the TPN goes directly into the veins.
So one of them is an IV,
Yes.
and the other one is actually what would you call that, a port or a...
No, a peg.
A peg,
Yes.
okay.
It could go through nasogastric tubes or through a tube inserted in the stomach.
And sometimes those pegs are permanent, right?
Yes,
and
sometimes
sometimes
they are.
they're temporary.
Correct.
Okay.
Correct. Sometimes the body just needs an opportunity to relax and heal a little bit. Sometimes patient, depending on their injury, if it's chest or upper, they may have issues with swallowing initially, especially if they had a tracheostomy. And so sometimes until they regain the strength, and they would work with our speech pathologist to strengthen their cords so that they can resume their swallowing.
Well, I'm glad you mentioned that about swallowing, because one of the things that sometimes happens to people that have Alzheimer's disease is that they can't swallow anymore.
Right.
And, that's a problem, because then they can aspirate their food.
That's correct.
Aspirate their drinks, goes into their lungs, and then they
Right.
get pneumonia.
Right.
And that is a problem, because with dementia, the brain sometimes just doesn't know
doesn't
how to work that way anymore, can't tell the throat or the teeth and the mouth how to move and chew the food and how to swallow right, and they lose sometimes that ability.
That's correct. And so we have a specialized unit that takes care of such patients. And those patients needs a lot of cueing, a lot of reminders. Sometimes you even have to tell them, open your mouth, close your mouth, chew your food, okay, swallow now. And we have to make sure that their feedings are supervised and that their positioning is correct so that, prevent the risk of aspiration.
Or choking. And I know one of the things also with people that have Alzheimer's, they like to what they call squirrel their food or pocket their food.
Correct.
Can you explain what that is to everyone?
Pocketing your food is when you take your food and you kind of hide it in your cheek. Okay, that's called pocketing. So they take the food, they chew, but they don't swallow. And then they may open their mouths for another serving, but got to make sure that it's swallowed
They look
first.
like big chipmunks sometimes, right? It's like called squirreling away, like the squirrel keeping the nuts and not swallowing them.
That's correct.
And so you can actually help people to help them in that situation so that they're not going to choke or squirrel their food, and that they're going to be able to get their nutrition hopefully in the normal way as possible. Otherwise, they have to go
other alternatives.
The other alternative.
Yes. And of course, that would be based on assessments and decisions between the physician and the family. Mm-hmm. Yeah.
I know a lot of people don't want to have extraordinary measures
Yeah.
when they're doing their living wills and things like that, and a lot of people don't want to be on feeding tubes.
That's
and if they
correct.
have dementia, they decide, you know what, why go that route? Let's have quality of life. So you have a decision there, not only a medical decision, but you have a quality of life decision.
That's correct. And sometimes, this is one of the things that creates a lot of dilemmas, ethical dilemmas for the staff as well as for the families. However, our teams work with them, with both the patients, the families, the physicians as well, to just try to make the best decision for the patient under such circumstances. And then whatever decision is made, we as caregivers just have to respect it and continue to do our part by supporting the patient.
Right, because when someone comes to a skilled nursing facility, and Katie and I have been talking about some of the differences between dementia assisted living like Arden Courts and then skilled nursing care like Manor Care, we're talking about more end of life when people go into a skilled nursing facility. You're talking about end stage dementia.
Yes.
You're talking about someone who certainly can't be at home anymore and probably can't be at an assisted living anymore.
That's correct.
So you have to help the families through all of this.
That's correct.
And I'm sure it's very difficult because you are dealing with end stage. And so how do you help the caregivers deal with that?
Well, as I said, our team is trained to treat not just the patient, but also the family members. And once again, we take it kind of on a case by case. It depends on what's causing dementia, number one, and number two, what the desires of the patient and or the families are. And, we work with teams, and sometimes, we have other groups that offer support to us. I don't want to call their names because, we didn't have
But in
permission
general,
to, but
you can bring hospice in too as a support system?
We can bring hospice in as a support system, and, we're always there for the families. We have care plan meetings just to keep everyone up to date on what's happening, the patient's progress, and the plan of care for the patient.
Okay. So at what stage, we're talking about what is appropriate. So when you're doing your assessment and you're trying to determine if you can admit this person into the skilled nursing, especially into the dementia unit, what would be not appropriate?
What would not be appropriate for our dementia unit? Well, first of all, is the patient would need to have some, or the family members would need to be clear as to what their desires are. The care that we deliver helps to support the total patient. So it doesn't matter if the patient is not able to help themselves. That's why we are there for the patient. But typically, if a patient on admission knows exactly that they do not need any of our services, then we would not. We'd go down all the list of services we provide, and if we see that we cannot provide what their needs are, then we would make recommendations otherwise. Yeah.
Okay.
Yeah.
Well, in assisted living for dementia, we do our assessment too to see if someone is appropriate to come in. And, that would be the point where we would look at certain criteria.
Yes.
And we want to watch and assess them to see how they walk.
Right.
We might look at and see how they talk,
Yes.
how they transfer. Maybe we'll look at their medical and see what kind of medical needs they have that
That's
might
correct.
not be above and beyond what assisted living licenses allow us to do.
Right,
All
right.
So we're looking at all of those things too.
Right.
And I always tell families, if you're going to make a placement, because they always say, I don't think I can do this forever.
Yeah.
They know it's hard. They know it's overwhelming taking care of someone with dementia, Alzheimer's.
Exactly.
But sometimes families wait too long.
That's correct. It's so important to start having the conversation from before. They have groups now that are encouraging families. You get to a certain age, start the conversation. Don't wait until
It's too late.
the decision is thrust upon you where you need to make a decision now. Allow yourself time to do research and think about it and make plans, so that if the day comes, then you'll know exactly what you need and exactly what to do.
Right.
Right. So as I was saying before, the difference between the assisted living facility and us is that we can take a patient even when the patient is not able to care for themselves, because we do provide that level of care for them.
Right. So we, like you, help with all the ADLs, and
Yes.
ADLs are activities of
daily
daily living,
living.
like bathing, dressing, grooming, eating. So we both help that. It's basically, though, to what extent that they
Right.
get the help. And that's one of the big differences.
Yeah.
And so in assisted living, we would have someone to move in because they're appropriate under the guidelines of that the state of Florida sets for assisted living. And they live with us.
Yeah.
And then they're going to decline because Alzheimer's disease is a progressive disease. It never gets any better. It always gets worse, as you know. And there's going to come a point in time when we may have to make some other decisions.
Right.
If a resident at an assisted living exhibits what I call a red flag,
Yeah.
okay, a red flag might be can't swallow anymore. It might be they can't walk anymore. It might be that they have some other medical issues going on that's pretty extensive.
Yeah.
So we're going to look at that. If we see a red flag, then we're going to have a conversation with the family. We also have our service agreements, and we work with families of how we're actually meeting the needs of that particular resident.
Yeah.
But if we see one of these red flags, that's sort of our trigger, as I would say, a trigger to talk to the family, give them options, discuss the situation, what's going on, and then we lay it out for them and say, all right, these are your options. Because of XYZ that's going on with your loved one, they can no longer live in assisted living, okay, unless, and then we give them some options.
Yes.
And
Yeah.
one of the options might be, let's see if the person is a candidate for hospice care.
Right.
Now, I know hospice comes into your building, they come into assisted livings also. And with hospice on board, that would allow someone who normally couldn't stay in assisted living to be there longer.
Right.
And most of the families want to continue to have their loved one in a home-like setting and not go to a nursing home. And that's what hospice allows them to do. So they can come into the assisted living just like they go into your own home,
Right.
and just like they can go into the nursing home. So that's one option. Sometimes a person, because of different issues that might be going on with them with their Alzheimer's, sometimes they might need a private duty with them. And sometimes that allows them to stay a little bit longer also. And sometimes they have no choice. Sometimes they must move on to a skilled nursing facility, and we would give the referral, and you would come and assess them, and then they would make that transition. So, basically we're talking about when is somebody appropriate for dementia assisted living, and when is someone appropriate for dementia skilled nursing.
yeah.
And that's what we're talking about today. And I love this conversation. It's so great. It's something that people really don't talk about.
And they should.
And they should.
Yeah.
And it's important because to get this information ahead of time, like you said, it's going to alleviate. Let me give you an example. Just last week, I had a daughter who's taking care of her mother at home. Mother had Alzheimer's, and she's been taking care of her for 13 years.
Wow.
And after all that time, I mean, I can't imagine doing it, for more than 3, but 13 years at home, she finally decided that maybe Mom would be better in a community, a facility, and so she called us, and so we sent our nurse out to the home. We assessed the lady, and it was very clear that the daughter waited too long. Yeah, she definitely waited too long, and unfortunately we had to tell her that we could not accept her, that she needed to go to a skilled nursing facility. And she was very sad and disappointed and felt a lot more guilty because, you've probably talked to spouses that say, I promised my wife or I promised my husband I'd never put him in a nursing home.
That's correct. It happens a lot, and there's a lot of guilt that comes with it. But would you like to talk about the respite program?
Yeah, we have respite. At the
You have
facility.
respite?
So, yeah, which
Yeah.
you mentioned briefly earlier.
Good. Well, we're
going
going to take a quick break, and when we come back, Katie's going to tell us all about respite. So stay with us. We'll be right back.
Do you need the advice of an elder law attorney but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. They bring elder law to you by meeting with you in the comfort of your own surroundings to discuss your personal situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143. 954-383-1143. They bring elder law to you. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice. Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, we've been talking to Katie DeRocher and Carrie Ann Baker. They're from the Manor Care Health Services right here in Boca Raton, Florida. Thank you, ladies, again for coming.
Thanks for having
It's great to talk to you. We're talking about the differences between a dementia-assisted living and dementia skilled nursing and when someone would need one or the other. So it's very important to know the criteria, very important to know when to make that plan, not wait too long.
Right.
We talked about guilt a little bit a
Yes.
second ago about how spouses say, I'll never put you in a nursing home. And one way that I tell them to possibly prevent that, because that's their worst fear, is, if they have dementia, don't wait until it's too late. Check out Arden Courts, check out a dementia assisted living, because probably if you do that, the chances are you might not have to go on to a skilled nursing. So we're talking about, how you can stay long-term in assisted living for dementia and when you would have to go. And one of the things is wounds, too.
Yes.
And so assisted livings can take care of certain wounds, certain stages of wounds. A lot of people that have dementia, sometimes they might be in a wheelchair and they might rub their heel and they might get, like a blister.
Perforation, yeah.
And so we have to check that and make sure that it doesn't go above and beyond what we're allowed to take care of.
Right.
And if it does, then we send them to you,
Yeah.
and then you can do more extensive wound care.
Yes.
You can heal it up, and then they can come back. So that's something else where, you might have someone in a skilled nursing facility for short-term rehab that Katie and I were talking about earlier, but you also might have someone who goes for a certain service like wound care and then comes back, because the state does dictate, what certain facilities can do and what they can't do.
Correct.
So we're all in this together to help everybody, right?
Yes,
So
absolutely.
Katie mentioned respite. I want to know how you can help some of the caregivers, because Arden Courts does respite care. So tell me about your respite program.
Yeah, we also have respite care. Usually it's about 5 days. It's average. I mean, you can pay additional if you'd like for extra time. But if a caregiver or a family member needs a break from taking care of their loved one, they would bring them to us to get a little break. We've had a family that came to us before they were going to a wedding. It was a grandchild, and they needed a break. So they left the grandparent at the facility to stay with us for 5 days while they went to the wedding. And it worked out really well. We give them the 24-hour nursing care while they're with us, administer all the medications, take care of them at the facility. It's very easy to get them into the.
So they
the
both went on a
facility.
vacation.
Yeah, they did. They got a little break.
That's correct.
And then when the caretakers come back, they're refreshed. They've had some time off and they're feeling good. And
Very important. Very, very important. How much time in advance would a caregiver need to notify you if they did want to plan a respite stay at a skilled nursing facility like Manor Care?
pretty quickly, we can get it done, within a day.
Oh, you can?
Yeah, we have to get a doctor to sign off on it. There's a form that we need from the doctor and some clinical information, but we can get it, if the family helps out, we can get it overnight, get them moved in really quick.
So it can be something quick.
Yeah.
So if you're stressed out as a caregiver and you just need a break, call Katie. She'll help you get that respite. Usually a 5-day. That's a nice amount of time, and they pay per day.
Yeah.
Right.
And we do a lot of hospice respite cases as well. So if it's a hospice patient and they have dementia, the hospice will also contact us to set it up. So if anybody out there is getting hospice care right now, we can do that as well.
Okay, that's good. And now that we're talking about days, one thing that I really want to talk about quickly before we have to end our show is the fact that people seem to be confused with rehab and how many days that Medicare pays, how many days their insurance pays, what they get. Sometimes they think they're entitled to more than they get, and that's a problem. So, it's important for people to know that you're going to get the days in a rehab according to how much improvement that person is actually getting. Do you want to explain that a little bit, Carrie?
Okay, typically Medicare gives 100 days, but that's total. So if you started, say you got sick before and you were in an acute rehab, you got well, you went back home, and within, say, 30 days, etc., you're back in the hospital, then it would be 100 minus the number of days that were left before. And then for insurance, it's mostly driven by, number one, what your coverage is, and number two, how sick you are and the length of stay that you will need. Sometimes patients feel that they're not ready, or the initial time that the insurance allocates is not enough. Then if we have enough clinical information to show that, yes, this patient would benefit from additional stay, then more than likely the insurance will say go ahead. But some persons, they're just afraid to go back out on their own because of the experience they may have had prior to coming into the facility. And so sometimes it's heartbreaking, to let them go. Sometimes they are denied additional stay, but
Because it all depends on what they really need.
it
They
depends on the services that
can't
they
stay
really
there
need.
just because they're comfortable and they think you're nice and they like
Yeah.
looking at your pretty faces.
No.
But I always say that they have to be certified for additional stay.
yes, they
So
have
as
to
long
be.
as someone is, let's say they're in rehab and they're making improvement, and you look at that every couple weeks to
Every
check
week,
every week
actually,
to
yes.
check their progress. And
Right.
so they're getting better and getting better. As long as they're improving, but if they hit a plateau
Right.
where they're not improving anymore, they're not getting better with the physical therapy, that would be pretty much the time that you might say, well, you've reached your limit, even though it's
correct.
not 100 days, because
Right.
even though Medicare would allow 100 days,
Right.
you might not get 100 days because you've reached your plateau, your limit.
That's correct.
And so you would then be given a few days' notice that
Right.
you're going to get ready to go back home. Is that correct?
That's correct, or transition to a lower level of care. Yeah.
Okay.
We'll find placement for them elsewhere.
Like Arden Courts, if they
Yeah.
have dementia,
Yeah,
right?
we'll send them back. Yes.
Yeah.
We have a social worker that will set all that up.
Good. So you do have people to help and explain things to them.
Oh, yeah. We have a fantastic team, social workers. Of course, our rehab, got to speak about our rehab. They're fantastic, highly skilled, really great results with our rehab team. And we have a specialized unit for acute rehab. I did mention before post-surgical patients that we take in, specifically orthopedic patients, and we do very, very well with those patients.
I know it's really nice because your building sits right next to our building at Arden Courts, and we've had a resident that has Alzheimer's live with us, and the caregiver unfortunately maybe fell, broke their hip,
Yeah.
ended up in rehab to you. And what was nice about it is that because we shared the same parking lot, we were able to let them see each other.
Oh,
And so
wow.
we
Right,
just,
yeah.
either we brought them to you or you brought them to us, and just right across the parking lot. It was wonderful because they wanted to continue to see each other, and the
Yes.
caregiver obviously wasn't able to, drive and come over from home, but we were able to work that out, and I think that was an awesome team effort.
Fantastic. Yeah. Oh,
So
absolutely.
we tried to do that. If someone had questions, Katie, for you as the admissions person, or Carrie, you from a nursing perspective,
Right.
could they call you? Could they set up a tour to come visit you?
Yeah, we definitely encourage tours. It's a good idea to come and check the facilities out before you make any decisions, and make sure that you even like them. You can come by anytime. We do tours 7 days a week. Our phone number at the facility is 561-997-8111, and you can come by and meet with me anytime. I'll introduce you to our team, and Carrie Ann will be there at the facility if you have any questions.
So people, when they're faced with maybe a hospital discharge, and the case manager at the hospital says, well, where do you want to go for your rehab? It's hard because they don't know where to pick. And if they're not where there's a manor care close by enough, but how would someone choose? How would they, some criteria how to choose a skilled nursing facility? Obviously, they come to visit, but what should they look for?
You want to definitely check out the cleanliness of the facility. Make sure that you don't, see a lot of patients congregating in the lobby. That there's no odors. That's something that we hear a lot of times on tours. Survey results. You can go to Medicare.gov and read about the facilities and see how they've done on their annual inspections.
That's a good
something.
thing.
Yeah, definitely want to read about them and see how they stack up to the competitors in the area. Private rooms. We have all complimentary private rooms for our rehab patients. So
Awesome.
we want to see if some of the buildings might charge in the area. That might be important too.
That's great. So
Yeah.
there you go. You can call Carrie. You can call Katie. Stay with us because we're coming back next week. We have another great show for you. Don't forget, Caregiver Solutions Info is your show for you, the caregiver. Let us know what you need. We're right here for you. In the meantime, don't forget, give someone a hug, and we'll see you next week with Caregiver Solutions Info. Thank you. See you next time.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.